So external respiration includes pulmonary ventilation and then gas diffusion. Again, we're looking at what's happening in the lungs as we exchange gases with the environment. So we said that pulmonary ventilation was just what? Breathing, right? Bringing air in and pushing air out. It's just the physical movement of air into your lungs and then pushing the air out of your lungs. The gases are not going anywhere. There's no diffusion. It's just moving a bunch of air in and then pushing a bunch of air out. When we talk about pulmonary ventilation, pressure is very, very important. Okay, so the overall pressure of the air, the overall pressure in your lungs. So we'll talk a lot about atmospheric pressure, and this is literally just the pressure of the air around us, okay, or the pressure of the atmosphere. This is going to be very important because the air around us is constantly pushing in on us. And we'll see that we alter the air, the pressure in our lungs according to the pressure around us. We go a little bit less than the pressure around us, and then we go a little bit above the pressure around us. So we're constantly altering the pressure in our lungs according to the atmospheric pressure. Atmospheric pressure averages about 760 millimeters of mercury. That changes based on altitude, based on weather patterns, based on lots of different things. But we're gonna just go with 760 millimeters of mercury. The exact number doesn't really matter. So as we go through pulmonary ventilation and gas diffusion and really all of this, we're gonna talk about multiple different gas laws. Like, don't get bogged down with this. I'm not gonna ask you to memorize the names or which law is which and what the laws state. I just want you to understand what's happening. So we'll kind of talk through the gas laws, we'll talk about the physiology, and then you can just take that, and try to understand the process in the body. Again, don't get caught up with these, just understand what's happening in your body. And we've kind of talked about this a lot. Without naming Boyle's law, we've talked about volume and pressure and the way that they relate. So Boyle's law states that pressure equals 1 over volume. Okay, so that's just telling us that the pressure is inversely related to the volume. What does that mean? If one goes up, what does the other do? Go down, right? They vary in opposite directions. If the volume goes up, the pressure goes down. If the volume goes down, the pressure goes up, right? Pretty simple. And this makes sense, right? We can kind of picture this in our heads. If I have something here and I squeeze the volume to make it smaller, you can imagine that it's more pressure, right? There's more squeeze, there's more pressure in it. And we talked about this a little bit when we talked about the cardiovascular system as well. But so decreasing the size of and this is assuming gas stays the same. I'm not adding molecules, I'm not taking molecules away. It's one set amount of gas that's present. If I were to decrease the size of the container, so if I were to decrease the volume, what happens to the pressure? Increase the pressure. If I were to increase the volume, what do I do to the pressure? What? Decrease it, right? They vary inversely in opposite directions. This shows us why. And I know we've already talked about this concept a lot and you guys probably understand it, but it's really kind of cool to think about why this occurs. I should include this in the cardiovascular section because I really like this slide. So here we're looking at gases. And remember when we talk about a gas, so here we're talking about the air we breathe, but when we talk about a gas, remember the molecules are moving, right? They're not stationary, they're not put. The molecules of gas, of oxygen, nitrogen, CO2, whatever, are constantly randomly bouncing around at really high speeds. When they do this, they bounce into each other, right? They ricochet off each other, and then they bounce into the walls of the container. This is where pressure comes from. Okay, so every time one of these atoms is bumping into the wall of the container, it's exerting pressure on it. It's pushing out with some amount of force. The more collisions, the more pressure. Okay, so the more stuff's bumping into each other, the more the pressure is in that gas. So this is just kind of our standard. I don't know how many we have. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So we've got 14 molecules in this container. And if you look at the collisions, so look at this molecule here. It bounces in 1, 2, 3, 4, 5 collisions. So here, what are we doing to the volume of the container? Decreasing the volume, right? We made it smaller. We still have the same 14 molecules present, or 5 collisions. We still have the same 14 molecules present. Now we've just decreased the size of the container. So now look, when things start bouncing around, they don't have to go as far to get to the wall, right? The wall's pretty close, so they get there quicker. So let's see how many collisions we have. 1, 2, 3, 4, 5, 6. Okay, so that's 6 collisions that occurred. So if pressure exists because of a collision, right, bouncing into the container, then what do you think? Is 6 collisions more pressure or less pressure than 5? More, right? So we decreased the volume, we increased the pressure. Look here, so going from here to here, what did I do to the volume? I increased the volume, right? I've got the same 14 molecules, but now as this guy goes to try and bounce over here, and then over here, and then over here, look how much further he has to go, right? He's got a lot more space. That takes a lot more, that takes a lot more time, right? I can't measure it accurately. So there's less collisions, right? So 1, 2, 3, 4 collisions. So do you think that's more pressure or less pressure? Less pressure. I just think about it like us. If all of us are in this room and we all start running randomly, we're gonna feel like we're under a decent amount of pressure, right? Every time we run into each other, we bump into each other, it's a stressful situation. Now take us and put us in like a little tiny closet. The pressure goes up a bit, right? That's a little bit more stressful. We're gonna bump into each other like crazy. Then take us all and put us out on a football field. It's all right? That's a little bit better. We're not gonna have so many collisions there. So the smaller you cram things into, the higher the pressure is. Now, this is important because we're gonna utilize this relationship between volume and pressure in order to alter the pressure of the air in our lungs. And we can alter the pressure of the air in our lungs in order to force air in or force air out of our lungs. So, pulmonary ventilation is what? Breathing. During breathing or pulmonary ventilation, we cause volume changes in the lungs that alter the pressure of the air in the lungs, right? To increase the pressure or decrease the pressure. The reason we do this is that air flows from areas of high pressure to areas of low pressure, right? Just like the blood, right? The blood flowed from high to low, right? When we look at a ball, the ball rolls from high to low. Air flows from high pressure to low pressure. So we'll change the volume of the thoracic cavity during inhalation and exhalation. Changing the volume changes the what? Pressure. And air flows from what pressure to what pressure? High to low. So how do we change the volume of the thoracic cavity? We utilize our respiratory muscles. We have lots of respiratory muscles. Primarily, though, we're going to use the diaphragm, right? Which you've all heard of diaphragmatic breathing, or breathe from your diaphragm, speak from your diaphragm, sing from your diaphragm. And then the external intercostal muscles, which we'll see in the rib cage. So you guys can feel your rib cage move. Like breathe in for a sec. You feel it do this, right? It comes out and up. So that's mostly because of your external intercostal muscles. Remember the ones between your ribs? And this is just kind of showing us where the rib cage starts, and then you can see it come up and out in order to expand. Down here you see the diaphragm. When the diaphragm contracts, it moves down here. So we start with like this, and we end up with that. Okay, so that's a lot of extra volume, right? We change the volume of the thoracic cavity. So when we increase the volume of the thoracic cavity, what do we do to the pressure of the air inside? We decrease the air pressure, or the pressure of the air in the lungs or in the thoracic cavity. Again, the whole reason we're doing this is to affect airflow, right? To either pull air in or push air out. So we're gonna go through the whole process, and this should make plenty of sense now. Here's your diaphragm, okay, here's your pleural cavities, your lungs are sitting inside. Okay, you see your bronchi, your trachea, the atmospheric air is out here. Atmospheric air, we're gonna say, is at about 760 millimeters of mercury. That's the pressure of all this air out here. Remember, that pressure is constantly pushing in, right? That's the pressure of the air pushing in all over your body, on your skin, into your mouth, into any hole or opening, 760 millimeters of mercury. This is at rest. We see that the pressure outside, 760, equals the pressure in the alveoli, 760. Okay, the pressures are equal, so there's no air movement. Here, we see outside is still 760. But here what's happening is we are elevating the rib cage and contracting the diaphragm, right? So we're increasing the size of our thoracic cavity. When we increase the volume, what do we do to the pressure? Decrease the pressure. So now the pressure was 760. Now say it's 758. Air flows from what to what? High to low, right? So air is going to go from the high pressure out here into this low, think of it again like suction, right? Pulling the air in, goes to the lower pressure in here. So that again is called inhalation, okay? Pulling the air in. Next we have the opposite occur, exhalation. Out here still like 760. Now we allow those muscles to relax, right? We contracted the muscles to increase the volume. Now we let those muscles relax. And the lungs are really elastic, right? You remember from lab, all those little black lines we said were elastic fibers. So when these muscles relax, the lungs like to snap back to their original position. So now it was this big, and now we're making it this big. So what did we do to the volume? Decrease the volume. What did I do to the pressure? Increase the pressure. So now we'll say this is like 761, 762. Air flows from what to what? High to low. So where's the air going to go? Out, because the pressure's lower out here. That is exhalation. Pretty simple. Pretty simple. So you guys should be able to talk me through the whole process. Just 1 second. I think like 2 slides will get there. So intrapulmonary pressure or intraalveolar pressure is this lung pressure we're talking about. So when I say the pressure in the lungs, this is what I'm talking about, right? Intrapulmonary pressure or intraalveolar pressure. So that's like if you go all the way down into all the breathing tubes, remember how we get to these alveolar sacs, right, with all these individual alveoli? I'm talking about the air pressure in these alveoli, intraalveolar pressure. Again, I told you that the overall number doesn't really matter, right? Like the total pressure isn't really what's important. What's important is the relative pressure. Okay, so relative compared to the atmosphere. I just want to know, is the pressure in my lungs higher than the pressure around me or lower than the pressure around me? That's what matters. So while we breathe, the difference between the atmospheric pressure and the intrapulmonary pressure is very, very small. Okay, 1, maybe 2 millimeters of mercury. It's a very, very slight difference. Your textbook uses centimeters of H2O. Some of the other books use millimeters of mercury. We traditionally just kind of spout off millimeters of mercury. But don't worry about it. Again, I will never like make you memorize the specific numbers because they're different. If you go to Denver right now, the numbers are going to be different. It's just different at different like conditions. Again, different weather patterns, different. What am I saying? Not heights, but thank you. Altitudes. So don't worry about the exact numbers. But again, the point here is that we just alter the pressure in the lungs very little. Okay, a couple millimeters of mercury max, 1 or 2, compared to the pressure outside the lungs. A little bit less, air comes in. A little bit more, air goes out. So that's the intrapleural pressure or intraalveolar pressure. There is another pressure that we see in the lungs, and this is called the intrapleural pressure. Remember when we look at the lungs, like we've got the lung, and then we've got 2 membranes. Right, the visceral pleura, and that curves around, and the outer one is the parietal pleura. So we've got these 2 membranes, and we said that between them, that's the pleural cavity. And we put serous fluid in there, and that's the space that the lung has. There's a pressure that exists in there. Right? There's a pressure between those two pleural membranes. That's the intrapleural pressure. When we talk about the intrapleural pressure, we call this a negative pressure. The reason we call this a negative pressure is because it's always below atmospheric pressure. So it varies as we breathe in and breathe out, we inhale, we exhale. The pressure in between the membranes will change. Sometimes it might be 4 below atmospheric pressure. Sometimes it might be 2 below atmospheric pressure. It might be 1 below atmospheric pressure or 5 below atmospheric pressure, but it is always below atmospheric pressure. Okay, so that's what we call it a negative pressure. It's always negative. It's always less than the pressure of the atmosphere pushing in. This is important because this is one of the other things that helps to keep the lungs open. Okay, that negative pressure, again, think of it like suction. That way the lungs don't collapse. And there's always some suction kind of holding us out against the body wall, regardless of whether air is coming in or out. Okay, so you guys should be able to kind of talk through and understand this very, very well. The respiratory cycle is just one single cycle of inhalation and exhalation. Okay, so pulling air in and then pushing air out. At the beginning, remember the pressures are all equal. Right? The atmospheric pressure is the same as the intrapulmonary or intraalveolar pressure, and there's no movement of air whatsoever. Then we start to inhale. What does that mean? Pull air in or out? In, right? Inhale is to pull air in. So when we do that, what happens to the intrapulmonary pressure, the pressure in our lungs? Does it go up or down? Down, right? We decrease the pressure, that pulls the air in. So intrapulmonary pressure goes down. Now, how did we do that? What did we do to the volume? Good, we increased the volume of the thoracic cavity. How did we do that? Expanding the rib cage, contracting the diaphragm. Okay, perfect. So expand the rib cage and contract the diaphragm. Right, that increases the volume. You increase the volume, you decrease the pressure. Air flows from high pressure to low pressure. That's inhalation. Exhalation, remember, is the opposite. Hey, what happens to intrapulmonary pressure when we exhale? It increases, right? The pressure goes up, and that pushes the air out. Why? What happens to the volume of the thoracic cavity? Goes down, right? We decrease the volume. And remember, that is mostly going to be elastic. The muscles relax, the elasticity snaps it back to normal. Decrease in the volume, increases the pressure, air flows out. Because air flows from what to what? High to low. You guys could take that half this test right now. Tidal volume, or V sub T, just refers to the amount of air that we move in and out during a respiratory cycle. During eupnea is just like quiet, restful breathing. It's normally about 500 mLs. We can vary that greatly. We can inhale way more than that, and we can push out. We've got a big reserve volume that we can push out, and it differs a lot. So you just male to female, the size of your body, it varies a lot. Don't worry about this. Really, this is just everything we talked about, and I think we kind of killed with the subject. This is just intrapulmonary pressure, right? Pressure goes down when we inhale, pressure goes up when we exhale. This shows you intrapleural pressure, the pressure between the membranes. Look, notice it's always negative, right? It fluctuates, but it is always down in the negatives, and that's like a suction to keep those lungs open. This is just tidal volume, right? So here's in the milliliters, the volume that comes in and then the volume that goes out. Okay, so we said that we have respiratory muscles, and we utilize those respiratory muscles to change the volume of the thoracic cavity. These muscles are important mostly for inhalation, right? When we expand that rib cage and compress that diaphragm. The most important of these inspiratory muscles, right, or muscles that we use during inspiration are the, what, you tell me? Diaphragm and the external intercostals. We also have accessory muscles. So we'll see them on the next page, but with the abdominal muscles, the internal intercostals, the sternocleidomastoid, a lot of these other muscles are just used when we really like greatly increase inspiration. So that could mean we're breathing really deep, right? It's not just a quiet breathing anymore, it's really deep, that uses extra muscles. Or really fast, when you increase your rate of breathing, now you cut your inspiration short and you force that air out. Forcing the air out takes extra muscles. Okay, so anytime we increase either the depth or rate of respiration, we can start to utilize these accessory muscles. Normal exhalation is a passive process. Normal restful breathing, we do not utilize muscles to exhale. Okay, we don't have to have any muscles contract to force that air out. Again, we said that the lungs are very elastic. So when the diaphragm and the intercostals relax, the lungs like to snap back. Okay, they go back to their original position, and that itself forces the air out. Again, forceful exhalation utilizes the accessory muscles, but typically exhalation is passive and does not utilize any muscle contraction. Here we see the muscles that are involved in breathing. I only expect you to memorize the primary muscles of inhalation. So again, the diaphragm is this huge, this huge dome-shaped muscle at the bottom of the thoracic cavity. The intercostals, remember you have internal intercostals and then you have external intercostals. So we're talking about the external intercostals back here, and those are what we use to breathe in. What do we use to breathe out? Elastic rebound. Okay, just elastic rebound, unless it's forceful. Then we'll start to use the accessory muscles. And again, we've got the sternocleidomastoid, you see the scalenes up there in the neck, pectoral muscles in the chest, your internal intercostals, the abdominal muscles. Okay, there's a lot that comes into play when we start breathing really heavily or really deep. So there are different types of breathing. You just heard me say the word eupnea or quiet breathing. Eupnea or quiet breathing is just this normal, again, when you're sitting here really restfully, passively breathing. And that's what we've been talking about this whole time. It involves active inhalation, right, utilizing your normal inspiratory muscles, and passive exhalation that just utilizes elastic rebound. We can describe our breathing as diaphragmatic or costal. Okay, and this is like if you sing or do acting, I'm sure you've heard these terms before, but diaphragmatic breathing is deep breathing, because remember the diaphragm is at the very deep or the very bottom portion of the thoracic cavity. So diaphragmatic breathing is when you're mostly using the diaphragm to pull the air deep down within the lungs. Costal breathing is very shallow. Costal, remember, is referring to the ribs. So costal breathing is more of a shallow, bringing the air out into the lateral areas of the lungs, not deep within the lungs. So again, a more shallow breathing that's mostly because of the rib cage. Forced breathing or hyperpnea is no longer passive exhalation. Okay, now we have active inhalation, and normally it's not just the normal muscles. Now we're going to start utilizing those accessory muscles like the abdominal muscles. And active exhalation. So we really forcefully using a lot of extra muscles, bring the air in really deep, and then we force it out quick and hard by utilizing muscle contraction. And again, maximum levels occur during exhaustion. So if you got up and you went and ran and then came and stepped back down, you would be utilizing a lot of accessory muscles. Okay? Or if you had, COPD or something where it was really hard for you to oxygenate and hard for you to expand that rib cage and you were working really hard to do it, you would utilize these extra muscles and you'd be in forced breathing or hyperpnea. Okay, so that was pulmonary ventilation. Let's see what time we're at.